Congratulations! If you're watching this video, it means that you're considering Emory Psychiatry as one of your options for residency training. In this video, we will talk about how the various rotations are structured in our program, and we hope this will help you decide if our program is a good fit for you. We will divide this discussion by the PGY levels. Broadly speaking, the first 2 years of your training will be focused on inpatient, emergency, and consultation liaison psychiatry, while the last 2 will mostly consist of outpatient rotations and electives. One of the greatest strengths of Emory Psychiatry is the diversity of clinical training sites which the program offers. These include Grady Memorial Hospital, which is a public hospital, Emory University Hospital, which is a private hospital, and the Atlanta VA. This ensures that graduates are prepared to work in any clinical setting after completing their training. Let us start by looking at the first year of your training, also known as internship, which is perhaps the most important year in your training and lays down a strong foundation for your future clinical work. This year is divided into 6 months of psychiatry and 6 months of off-service rotations, such as medicine and neurology. Interns complete these rotations in blocks of 3 months, which means that half of the interns will start on psychiatry and the other half on off-service rotations. Everyone will switch after 3 months so that those who initially started on psychiatry will now be on medicine or neurology, and vice versa. The psychiatry portion of the training is based at Grady Memorial Hospital, which is one of the oldest and the largest public hospitals in the country. Your training is divided into the Grady Inpatient Unit, also known as 13A, Psychiatry Emergency Services, also known as PES, and the Community Psychiatry Rotations. You will be spending a total of 3 months on 13A. Here you will be working with a multidisciplinary treatment team and taking care of 6 patients on an average day. During your PES rotation, you will be working in Grady's psychiatric emergency room. This rotation is a total of 2 months, which includes 1 month of days and 1 month of nights divided into 2 2-week blocks of night float. During the first half of the year, you will be working with an upper-level resident on your night float rotation who will help to guide you as you learn how to practice emergency psychiatry. During the second half of the year, you will be working in the PES with in-person attending supervision until midnight and an attending available by phone between midnight and 8 a.m. On your community psychiatry rotation, you will be exposed to a variety of outpatient services available through Grady to care for the mental health needs of your patients outside the hospital. Experiences include the Women's Clinic, Medicine Psychiatry Clinic, Integrated Care Clinic, Assertive Community Treatment or ACT, Forensics, and the P-STAR or Persistent Symptoms Treatment, Assessment, and Recovery Clinic, which focuses on patients with treatment-resistant psychosis. This rotation also includes a resident wellness half-day, which you can utilize however you want, such as going for a hike or a doctor's appointment, spending the time with your loved ones, or catching up on your sleep. The other 6 months of the PGY-1 year include 2 months of neurology and 4 months of medicine or pediatrics, based on individual preference. Residents typically complete 1 month of inpatient medicine at Grady and can provide individual preferences for the other 3 months. There are various options depending on availability, including emergency medicine, subspecialty consults at the VA, and fast-track clinic at the VA. There are also pediatric experiences including developmental and behavioral pediatrics, depending on availability. The neurology rotations are based at Grady and include 1 month of inpatient neurology and 1 month of neurology consults. Let us move on to the second year. This is the year you transition from being an intern to gaining more responsibility as a resident. PGY-2s work primarily on the inpatient units at Emory and the VA, as well as the CL services at Emory and Grady. In the simplest terms, you can think of the PGY-2 year as 2 6-month blocks, the Emory block and the VA and Grady block. On the Emory block, residents spend 8 weeks on Emory's adult inpatient unit and 4 weeks on the geriatric rotation. The geriatric rotation is also the time when you work in the neuromodulation clinic and get exposed to treatment modalities like ECT, TMS, and ketamine infusion for treatment-resistant depression. The The residents spend 8 weeks on the consultation liaison service on the Emory half. In addition, residents also complete a 2-week block on the Child Consultation Liaison Service at Children's Healthcare of Atlanta. Residents have an opportunity to participate in a 2-week elective during this block. There are over 40 different elective opportunities, including clinical and basic sciences research, forensics, family therapy, treatment-resistant depression clinic, addictions, and global health options. During the Emory 6-month block, residents will have approximately 2 2-week blocks of night float where they will cover admissions to the inpatient unit. On the VA and Grady block, residents complete 8 weeks on the inpatient unit at the VA. They also complete a 4-week outpatient addiction rotation at the VA, where they participate in evaluation and treatment of patients with substance use disorders. In addition, residents will complete 8 weeks of consultation liaison at Grady Hospital. There's also a 2-week elective opportunity during this block. During these 6 months, residents will have 2 2-week blocks of night float at the VA. This is also the year when residents start seeing their own psychotherapy patients. PGY-2 residents have a half day of protected time for psychotherapy training. After a series of introductory lectures and exercises, residents begin their supervised psychotherapy work in the PGY-2 year through the Outpatient Psychotherapy Training Program, or OPTP. With supervision, residents see up to 2 psychotherapy patients this year and begin to learn the basics of different psychotherapy modalities like CBT and psychodynamic psychotherapy. Third year is an outpatient year, which allows for increased flexibility in your schedule as well as more autonomy with regards to patient care. The PGY-3 year is based at one of 3 outpatient community sites, which include 10 Park Place, which is affiliated with Grady Memorial Hospital, Veterans Affairs Medical Center, or the Student Health Center at Emory University. Residents will spend a total of 4 half-days at their assigned outpatient site. In addition, residents will spend 1 half-day in the Child and Adolescent Psychiatry Clinic and 1 half-day in the Psychopharmacology Outpatient Clinic. These experiences are based at Emory Brain Health Center at 12 Executive Park. In addition, residents maintain an expanded longitudinal outpatient psychotherapy experience through the Outpatient Psychotherapy Training Program, also based at 12 Executive Park. Your psychotherapy caseload increases from 2 patients in second year to 4 patients this year, spread over 2 half-days. The PGY-4 year in general psychiatry is designed to offer a variety of elective and selective clinical and research opportunities to supplement ongoing outpatient experience. Residents may individualize their 4th year to include primarily 1 experience, or can combine several experiences at various clinical sites. Chief resident positions are available at Emory inpatient and outpatient clinics, Grady Memorial Hospital, and the Atlanta VA. A chief resident position for research is also available. We also want to mention that there are different tracks available, including the psychotherapy, research, and global and population health tracks. Participants in these tracks will have protected time to participate in individualized activities, and the schedule we discussed may be slightly different. Additional unique training tracks are available through GME and include opportunities in global health, quality improvement, medical education, ethics, and healthcare management. Residents also have an opportunity to participate in the Emory Psychoanalytic Institute, a 2-year core program that consists of twice-weekly classes and case seminars and has earned national recognition for the innovative teaching in psychoanalytic education. For all the years, Wednesday mornings are reserved for didactics and grand rounds. This is a protected time, and residents are relieved from all clinical duties. During this time, you will also get to see all your classmates and other residents in the program. Each class has a well-structured didactic curriculum, which is re-evaluated annually based on feedback from residents and faculty. We hope that this video helped you get a better understanding of what your life may look like as an Emory Psychiatry resident. We've packed a lot of information in this brief video. Please visit our website for additional information and feel free to reach out to us for any questions at the following email. Thank you for watching this video. We hope to see you at Emory in the future.